Salim Rizai here, and I want to talk about vitamin C and the metabolic cocktail in septic shock. As you can see, there are now 8 randomized clinical trials looking at this question. First, we probably need to stop spending money on research when funds are limited for something that's already been disproven over and over and over again. Now, a few points I just want to hit on. For proponents of this treatment who say, well, the medication is just not being given fast enough, we have ACTS and ATTEST, both which were performed in 2020, and medications were given on average within 1 to 2 hours of identifying people in septic shock. So that argument is now out. When we look at this table, you can see that there's almost no green on here. So Citrus Ali, which was published in 2019, is the only trial that showed improved mortality. The problem with this is that it was a secondary outcome, and there were 46 secondary outcomes in this study. When you have 46 secondary outcomes, just by random chance alone, you could have 1, 2, or 3 of those pop up positive. The second green table on here is the Oranges trial performed in 2020. Now, the thing with this one is that the primary outcome was changed from in-hospital mortality to time off pressors after all the data was collected. So if you remove those two things, everything is yellow on this table with one exception, and that was just the Lovett trial that was just published maybe a week or 2 ago. And they actually showed increased mortality. So I think it's time, short of people being deficient in vitamin C, if you're even checking those levels, we need to stop studying this. We need to stop giving patients this treatment, and we need to focus on the things that are the most important in sepsis management. And that's identifying these patients early, resuscitating them as well as we can. And the only treatment that has really been shown to reduce time off pressors in the sickest septic shock patients is corticosteroids. Finally, early, appropriate empiric antibiotics. These are the things that make a difference in mortality. These are the things that make a difference. It's not some voodoo medicine of vitamin C. Let me know your thoughts and comments. Thanks for tuning in, and until next time.